When I get older, losing my hair, many years from now, will you still be sending me a Valentine? Birthday greetings, bottle of wine.
Good afternoon. My name is John Lutz. I'm with Elder Services of Berkshire County, and this is Berkshire Senior TV. Thank you for being with us. Today we're going to talk about a very timely and very important topic, and that's the SHINE program and open enrollment. I have with me Shauna Post, who's the program director of the SHINE program, and I'm going to let you tell us what is SHINE.
SHINE is a state program under the Executive Office of Elder Affairs. Here in Berkshire County, it is housed at Elder Services. It stands for Serving Health Insurance Needs of Everyone with Medicare. So there are no age restrictions. We generally service individuals who are eligible for Medicare due to their age, 65 and older, but we do have we will serve individuals who are under 65, sometimes teenagers, who have become eligible for Medicare as a result of a disability.
Now, I know if people perhaps are reading the news or from other states, they might see the word SHIP, which I think is the federal designation for the SHINE program. But here in Massachusetts, it's called SHINE, Serving the Health Insurance Needs of Everyone. Yes. I think that's an important concept so that we let folks know of everyone, no age limit, no income limit, no barriers. If you have a question, you can call and talk to one of our trained counselors.
Absolutely. And here in Massachusetts and in Berkshire County, we operate on a decentralized system in that we try to make access as easy as possible. There are many counselors available throughout the community and throughout Berkshire County, usually housed in councils on aging, although we do have a few other partners. And
talk about those counselors a little bit. Who are they? What do they do? How often do they work? How do they get trained?
Sure. The vast majority of SHINE staff are volunteers. Just myself and Phyllis DiMartino, who I'm sure most people have heard of actually, are paid staff members. Everyone else is a volunteer. Most of them are retirees, or we do have some in-kind individuals from other agencies that we collaborate with. They train for about 50 hours initially. You know, it's almost a college level course. There's a state exam, and there is also mandatory mentoring, and then we do monthly meetings and annual testing to make sure that all of the information we're distributing is accurate and unbiased.
And I assume that if they stay volunteers, that every year there's also the various updates that come down from the feds.
Absolutely. We actually do those updates monthly.
Oh, okay. Mm-hmm. You talked about a couple other agencies. What agencies do we partner with as far as SHINE counselors?
We have partners with Berkshire Housing, AdLib, the Independent Living Center, EquuHealth, several of the several of the councils on aging also send staff members to us to be trained. We are currently working on a couple of side projects that we can't quite announce yet, but we hope to have some more people in the community soon.
And the idea is to try and get the information dispersed kind of as broadly as possible, and if someone is in Dalton or in Pittsfield or in Lenox or in Sheffield, that they can go hopefully as close as possible to get their counseling assistance.
Absolutely.
Okay.
Absolutely.
So let's go to the other topic for a few minutes. There's not just a coincidence that we're here talking about SHINE today. It's the beginning of October, and so it's the annual open enrollment. So help folks understand what that means to the uninitiated.
Okay, so open enrollment is every Medicare beneficiary's opportunity to evaluate their coverage.
Every,
okay. Regardless of income or assets or health. So, you know, I have people call me, you know, occasionally and say, well, you know, I never bother with open enrollment. I've been happy with my plan and it's served me well. And, you know, it basically comes down to you don't know what you don't know. This year we had 19 plans on the market. We saw some pretty dramatic changes for this previous year. We had premiums go up 242% for one plan. We've had corporate mergers where people were automatically assigned into a new plan, not based on their needs, but just because of business mergers. So you might be perfectly content with your plan, but you could potentially be saving money. Through the efforts of the SHINE program, just in Berkshire County alone, residents saved a little over $5 million, and that's by applying for public benefits on their behalf, and then also just helping them shop around for coverage.
And I think that 5 million, I think last year, if I remember, it was around 3,500, 3,800 people. So, we're talking about in the neighborhood of $100, $120 a month that people might be saving on their public and health insurance costs.
Yes, there is a spectrum. Some individuals have the potential to save a lot more. People who utilize a lot more services, lower income individuals who have public entitlements, but even individuals who don't qualify for any kind of assistance, we've seen a difference of $1,200 or $1,500 a month, or a year, just by switching a pharmacy, because there are preferred pharmacy networks that may not be widely advertised.
Now, you mentioned a couple minutes ago in your explanation about there being 19 plans. Mm-hmm. It would seem, just by definition, that is confusing. Mm-hmm. So are those 19 plans all offering the same thing, or how are you trying to help folks determine which of those 19 is best for them?
Yep. So I should probably clarify. There are 19 Part D plans, standalone drug plans, and there are also 5 Part C or Medicare Advantage plans available in Berkshire County. Open enrollment applies to them all as a group. When we're checking for coverage, we are checking for, we go beyond price. We look at the premium, which everyone does. We look at the deductibles. We look at the formularies, and we look at accessibility. So when we take all of these factors and we use the data to, we use Medicare.gov to determine what their anticipated cost for the year will be, and we can actually evaluate all of the plans simultaneously and tell them if they can get a better deal. And we try to take into account, an individual's lifestyle as well. So, if you live in Williamstown and you don't drive, and your current plan is telling you to go to Target, that's not necessarily a good deal for you. So we try to take all of those into account and really spend some time with an individual, making sure that they have the right fit.
Going to assume it has nothing to do with Target itself, but just perhaps where you're located in relation to Target.
Oh, goodness, I'm sorry, yes. I was just thinking of a place that had one location. Right. My apologies to Target.
That's all right.
I love Target.
Okay. So what about the situation, we often have couples come in, I know, into the office. Could it be that different plans are appropriate for for both spouse, for each of the spouses, a different plan could be better for them? Absolutely.
Medicare is a highly individualized process. You don't, depending on disparity in health outcomes, some individuals, the one spouse might be eligible for might be best served by a Part C plan, which is more of a bundle. It has a lower premium in general, but you pay more copays based on services. So if you're a low frequency user, it's not a bad deal. Then if we have a spouse who potentially has, maybe chronic health conditions or needs more flexibility in their treatment plans, perhaps the ability to go see a specialist in Boston or whatnot, they might, be looking at a different type of plan. The same holds true for brand loyalty. So they don't have to match. So if an individual, say, has a Part D drug plan and they take Humana because it worked out for them, they don't have to purchase the Humana supplement. They don't have to match because they might be better served by another company. Because the thing about supplements in Massachusetts is they're regulated by the state, and they have to offer the same level of coverage. So one company could be offering the product for $183, while another would be offering it for $260, and there is absolutely no difference in coverage between the two. So
I'll just say, at least off the top of my head, that seems a little confusing, that you would buy coverage from one place and you would buy your supplement from someplace else. But it sounds like that's exactly the reason why people should come and see a Shine, because there just might be a financial advantage, even though the coverage is going to be the same.
It can be confusing and it can be daunting. You know, having health insurance coverage is very, very important. A lot of people feel secure with some of the larger brand names, people they know, companies they've had for a long time. You know, it's always, the decision is always up to the individual, but one of our goals is to present the facts without marketing and just kind of help people make that decision. And you know, I always tell people at the end of the day, I mean, it's a card in your wallet and you use it and you serve it, but how much is it really playing a part of your life, what the brand is?
And I think it's important you point out that when someone comes to a Shine counselor, you know, we have no financial incentive at all to refer one person or one program or product over another. It's what's worked for you as the consumer and what's going to be best for you. We don't get any more money or less money, or we don't get very much money at all to begin with to do the program. So it doesn't really make a difference. We try and look for the best for those individuals. Absolutely.
We present materials for all of the available coverage and plans, and allow the individual to make a decision.
So I'm out watching this program. Maybe I have insomnia, something like that, and I say it's open enrollment time. I need to do something about my coverage. What should they do?
Well, every individual who has Medicare should be thinking, I need to do something with my coverage.
What if they don't do anything?
If they do nothing, they are likely to stay enrolled in the same plan unless the plan is discontinuing or if it's been merged with another group. But they should have already received a mailing detailing that. That's the other thing is notices have gone out telling people what the changes to their plans will be for next year. And you know, I can't tell you how many people we get calling us, you know, the first week of January because they missed that message, and then you know they're in a plan that's not appropriate for them anymore. And I would even encourage those people at that point to give us a call, because often we can do something to fix it.
But it's important to be looking for that notice in the midst of all the other junk mail you may or may not be getting. It's not junk, you know, if it's coming from CMS and Medicare or Medicaid.
Yep, anything from Social Security, Medicare, Medicaid, or a company that you're actually affiliated with is not junk. The rest of the marketing materials you can kind of cut through. We're happy to help give you, you know, the information on 1 or 2 pages.
So when someone calls the office, what happens?
Well, it depends. Depends on which office you're calling. Many of the councils on aging and other sites kind of have their own structure based on how busy they are. But generally, you will be referred to a Shine counselor. They will call you back. If they are able to, they will make an in-person appointment and have you come down to the center. In the regional office, we receive many requests during open enrollment. So we will often attempt to conduct business over the phone. When it's appropriate. If someone really needs to come in because their situation is complex or they have a barrier that makes phone conversations difficult for them, we try to accommodate them as much as possible. Outside of open enrollment, we try to have people come in as much as possible. But we'll call, we will request some of their information, we will need the information off of their Medicare card, we will request a detailed list of their medications. They can voluntarily disclose their income and assets. The reason we are asking that is so that we can screen them for public benefits. We do not record it at all. It's not reported to anyone. We're just ticking through the boxes. And you don't have to provide that information to receive counseling services. We can absolutely check your plan. We will go on to planfinder.gov, which is the recognized tool by Medicare. We will enter in the data, and then we assess it, and then we'll give you a call, and we'll tell you, your best 2 options with a deductible, without a deductible, any barriers that we think might be concerning, and we'll have that conversation. And if you want to make a change, we can most often do that enrollment right over the phone for you. We try to make it as easy as possible for people to evaluate their coverage. And typically,
I know there's always exceptions, how many times, if a person is going to come and meet in person, how many times they're going to need to come?
It depends. It depends. Often, if someone does not have a complex situation, say we have a welcome to Medicare, where when someone's going into Medicare for the first time, we have them come in. Our hope is that we've done, a good enough job, that we've provided enough information and guidance that they don't necessarily need to come back in for another appointment. If someone is applying for public benefits, sometimes it can take an additional appointment. Because they might have to gather documentation, or there might be some concerns. If we're doing an appeals case where someone is not receiving coverage for a medication that we think they probably should be, that can take time as well. So it really depends, but we try to get the job done in one visit whenever possible.
And when you refer to public benefits, can you give a couple examples, just so people have a feel for what that means?
Absolutely. So SHINE deals with public benefits as they relate to Medicare and Medicaid. We do have options counselors at Elder Services who will help with other public benefits such as SNAP and fuel assistance. But so for SHINE, we have the Extra Help program, which is a program run through the Social Security Administration that helps low-income individuals pay for their medications and their plans. It can mean a savings of, for some individuals, thousands of dollars a year. We have programs that help pay Part B premiums for individuals, so they put that $104 or $121.80 or $134 back into their check every month, which can be very helpful. We have a program called Prescription Advantage, which is sponsored by the state, that actually has a very high income limit. For a couple, I believe it goes all the way up to around $85,000. This program does two things. For most people, it's free, and it eliminates the donut hole, which is when the cost of an individual's medications nearly doubles at this point. It eliminates that and allows them to pay a copay based on their income, rather than paying $400 for their inhaler. They might pay $30. And it also gives every single member one special enrollment period a year. I like to tell people it's their get out of jail free card. So if
they threw away the notice that they got in the mail or
they
something.
threw away the notice, or if the plan makes a change mid-year. So that's kind of the catch-22 is consumers generally have one opportunity a year to make changes, while the plans can change their formularies and costs throughout the year. But we do have methods to address that. We look for special enrollment periods to make changes. We can request tier exceptions, where we usually partner with the physician and try to get that cost brought back down. I try to encourage people not to kind of just live with a problem until you've spoken to someone to see if there's anything at all that can be done.
Now, something that's become popular in private insurance market recently, and we've seen it in the workplace even, is, for lack of a better phrase, I think it's called catastrophic insurance. We're very high deductibles, low cost. Is that even something that's that's one of these 19 products? Is that something that they even offer in the Medicare world?
No. No, it's not really available. Medicare has a pretty high standard for minimum credible coverage in order to be a Medicare plan. No, I would say that's not an issue.
What about if someone, open enrollment's going to start soon? It goes for several weeks. What can someone be doing? They're trying to be a good, responsible. I'm going to go and get my Medicare checked. What are the kinds of things that they could be doing today to get ready for that visit that they're going to call and talk to their SHINE counselor, go down to their Council on Aging? What are the kinds of things that they could be doing to make sure that it's a productive visit for them and not a frustrating one for their counselor?
Well, they should create a detailed list of their medications. We have had people bring their bottles down in the past, which we will accept, although if a list is much better for us and less hassle for them. Their Medicare card. We absolutely need their Medicare card because we can't log into the system without their information. We need, if they'd like us to screen them for public benefits, bring in their reportable income. They don't have to bring documentation, but knowing what the number is. There are some people that are very close to the line, so knowing what that figure is. If they're asking us to evaluate a retiree plan or something outside of Medicare, for example, if we have a federal employee who wants us to compare the federal plan to the products available under Medicare, bringing in the detailed mail that they've sent so that a counselor has something to work with, because there are countless retiree plans and we don't know them all. So if we're going to be able to advise.
Use the example of a federal employee, but are you talking about someone even that retired from any corporation that has a retiree plan? They could actually bring those in for kind of cost and compare versus Medicare, that type of thing.
Absolutely, we've worked with several individuals from various corporations that have retired and had questions.
Even if their plan maybe especially if their plan changes after they've retired, and maybe they've been retired for quite a while, but all of a sudden their plan changes, they could come in and talk to a Shine counselor just to get an idea of whether they need to look at other alternatives.
Absolutely. That is something that we've seen over the last few years. Individuals that have had the same coverage for a number of years, some of their coverage has been changed or outsourced, and they've had questions and concerns, and we've been able to kind of, provide them unbiased information as opposed to a private broker, because we don't have a stake. Any plan that's available, we will introduce, and just kind of helping them get through that process.
And you've done this for a little while, in your experience as a Shine counselor, what are the things, I guess to say this in a positive way, what are the things to avoid so that you don't run into trouble as you're trying to either evaluate or perhaps get enrolled? What are the kinds of things that trip people up?
I would first, and I know it's very, very difficult because there's a tremendous amount of advertising and mailing coming to you, I would be cautious of the advertising material that you're receiving, because they're talking about their plan, and you want to go to an unbiased source. You can come to Shine. You can go to several of the navigators in our area actually assist with Medicare as well. You can go onto Medicare.gov and do the comparisons yourself. We're hoping to get something off the ground where we're going to start teaching individuals who wish to evaluate their own plans kind of how to do that so they don't have to come in every year. That's still on the burner. We are, the other thing is I would really caution people against paying individuals for this information. It is free, it is widely available, and there's really no reason. The same with Medicaid and other public benefits.
Mass Health in Massachusetts, right?
Mass Health, yes. We are perfectly equipped and happy to assist individuals with applying for these benefits, and there's absolutely no reason to spend that money when I'm sure it could be used elsewhere.
So I know every year open enrollment is kind of a crazy March Madness kind of feel to it, yes. At least around the office. Maybe we're not quite the fun at the end. We don't have any betting pools or anything like that. Go ahead.
We don't have any betting pools, no.
But that's that's only 6 weeks or so during the year. Does someone have to wait till now, or could someone come anytime to evaluate what their status is?
Someone could come, we're available year-round. Generally, we encourage people to come during open enrollment because that's when the new plan information is released, and you also don't need a special enrollment period to make a change.
Okay.
So that's kind of why that's such a busy time. But
for both new and existing?
Yes. But all year round, we're available for in-person appointments, consults, things like that. We help with public benefit applications year-round, which have no enrollment periods. Individuals who suddenly, find themselves not having adequate coverage, whether it be because their plan has changed or they've been prescribed new medications, maybe they're facing a new diagnosis, we're available for them. People turning 65, the center, there are 10,000 people going onto Medicare every day in this country, and we're there to do our small part to get those people set up. So. If you have a Medicare question, hopefully we have the answer, and we're a really great place to start.
But kind of like paying your taxes, there is a date by which you're supposed to have this done, and it's just a lot easier to do it during this period of time because there aren't quite the barriers. And then if you wait till after, you may be able to get, there'd be maybe perhaps penalties or circumstances which you wouldn't be able to get it done until the next open enrollment.
It can be significantly more difficult.
Right.
But we do everything that we can to try to at least mitigate the circumstances.
And I know last year, I think we mentioned earlier, we saw somewhere in the neighborhood of the net, not us, but the network of Shine counselors that we're responsible for, saw somewhere in the neighborhood of 3,800 people, save them on average, a little over $1,000, a little over $100 a month. And that's real impact here in Berkshire County. That, as you said, that nearly $4 or $5 million back into the community that's not going somewhere else or being paid to insurance that maybe wasn't really necessary, and that money staying in people's pockets. Folks that are on Medicare by definition have a fixed income, and every little bit helps. So that's quite a bit. I mean, that's a huge impact locally.
Absolutely, absolutely.
As we're starting to run out of time a little bit, give some, if you're planning to call, if you're planning to visit, boom, boom, boom. These are things to make sure you have in your back pocket or on the tip of your tongue or on your laptop when you come in.
Your medication list, your insurance cards, your income and assets if you wish us to screen for public benefits, and just yourself. Please call for an appointment before you come, because we are not always available, and we'd hate to have you make a trip for nothing. And that's it.
And that's the same, at Councils on Aging or any place that you're going to go. Just it's hard to just show up because the volunteers have different schedules and those kinds of things. So it's always best to call on the front end. Are there particular days? Not everyone's on the same schedule. So that's again, call wherever you're intending to go to make sure the counselor is going to be there and have an appointment before you go.
Absolutely. We do expand our hours during open enrollment to make sure that we are available for people, but you will need an appointment.
And is there anyone that has drop-in?
I'm not aware of anyone that has drop-in during open enrollment.
Because there's so much that's involved.
As an appointment can take an hour, sometimes more, and we want to make sure that when you come in, we are able to devote our time and energy to you and focus and make sure that we're resolving your issues. And eliminating walk-ins is the only way that we can really do that.
Great. Thank you for taking the time to come. We appreciate it. It's an annual event to have you here, and we'll look forward to having you come again. Thank you so much for watching.
I've been out till 2:45. Would you lock the door? Will you still need me? Will you still feed me when I'm 64?